Imagine that you got a mosquito bite, went to bed, and woke up with a fatal disease. This was the case for 3-year-old Raul Charuto, whose family found her unconscious and her skin was hot to the touch. After waking up 2 weeks later in the hospital, she could no longer walk, feed herself, or communicate. The Against Malaria Foundation works to prevent the spread of malaria by distributing long-lasting insecticide-treated mosquito nets to susceptible populations in developing countries.
The foundation funds bed nets, which are nets that protect people from mosquitoes. Each net costs $2.50, which will, on average, protect 2 people for up to 4 years. 100% of donations goes towards purchasing nets.
The foundation ensures the nets are used properly, including being placed where they need to be, over heads and over beds.
The foundation gathers 12 months of survey data to establish the need for nets prior to distribution, and continues to track infection rates for 3 to 4 years following distribution. It also monitors net use and condition, visiting around 5% of recipient households for randomized follow-up reporting.
The Against Malaria Foundation has been named a top charity by the Life You Can Save, Give Well, Giving What We Can, and Focusing Philanthropy.
Memory of it is that I had like flu-like. It just felt like my aches and pains, and I can remember I had to keep my eyes closed because I was so dizzy. That was something that I remember not only from the malaria but also from the treatment.
Do you remember the 3-year-old little girl Raul shared you from the beginning of the video? Well, if she would have gotten a net to put over her bed, then she would have gotten malaria and she would have still been able to walk and communicate.
And by donating Against Malaria Foundation, you are directly impacting women and children who are affected by malaria. About 90% of global deaths from malaria in 2013 occurred in Africa. Against Malaria Foundation has been active in 36 countries in Africa, Asia, South America, with a particular focus on sub-Saharan Africa.
Malaria is a particular problem for pregnant women.
A study of 1,158 adults in Kenya show more women than men suffer from malaria. This could be due to pregnancy and increased HIV in women than men.
Malaria infection is higher in pregnant women because of their decreased immunity.
Pregnant women with malaria have an increased risk of abortion, premature delivery, and low-weight infants.
There's still quite a risk for it, and so in preparation for that, we'll counsel our patients for treating prophylactically if they're traveling to that area. We'll also teach our patients to cover themselves and to use mosquito repellent that is effective in that area, and just to try to sleep inside, and if they can't sleep inside, then to have a repellent net to cover them when they're sleeping.
Living in America, we are ignorant to life-threatening diseases that impact women and children's lifestyles every single day. We don't realize how privileged we actually are until we are educated about these issues. We are called to show empathy for others who are not as fortunate as we are. A small, simple donation can impact so many lives.
As college students who are not financially well off, this charity is the best way to make a small amount of money count and make a difference. For just $2.50, you're protecting 2 people for up to 4 years. As Gonzaga students, skip your morning coffee and donate to Against Malaria Foundation to help the lives of 2 people.